Hi everybody, welcome to week 3. I'm coming you again from my front yard. I'm hoping you can see a little bit of the mountains in the background. We have some beautiful mountains in Utah. All right, week 3. So this week we've got a few things, and yes, we'll probably see cars going in and out from time to time since we're outside. But this week, our DQ question, we've got one about a nursing student performing an incorrect cranial nerve exam, and then one about a patient that we think may be cutting herself. And so those are kind of some interesting DQ topics. And the thing I really want to talk about this week, I think a little bit, kind of having to do a little bit with these situations, is how do we actually teach our nursing students how to do assessments? And if you think globally, holistic assessment, we've got physical, psychosocial, spiritual, kind of the whole shebang. And so we need to teach our students different skills that will be able to elicit the appropriate information. So physical assessment, a lot of that tends to be hands-on. Some of you might have gone to places or be at places where we have simulation mannequins. We can make them do all sorts of cool things, like have breath sounds and heart sounds and bowel sounds and things like that. I had one particular mannequin that was really cool. It could talk and had pulses, and you could make it sound like it was throwing up and all sorts of neat things. But the communication and being able to pick up on subtle things, those are skills that take a little longer for our students to learn. I know way back when I was in nursing school, my instructors would tell me that I should be able to stand in the doorway looking at the patient and have about 50% of my assessment data, my physical assessment data, from just those observation skills. And I think sometimes we forget how much information we can get strictly from observation. And so I'm going to include an article this week, and it's kind of a little different, but it's learning about health assessment in an art gallery. And basically it's the concept of how do we encourage our students to really look and see the patient. And so take a look at that and see what you think. It's a very different approach, but I think you'll find it interesting. Okay, so I'm looking forward to reading last week's assignment and seeing how things have changed from your initial submissions. This week we've got critique of your last physical exam, and hopefully you've had maybe one in the last year or at least the last couple years. A few things to remember. There is a word count, so make sure that you are staying within those words. And the things that I count in the word count are just the body of the paper. So when you submit something, if there's an abstract that's called for, or a reference page that's called for, something like that, those things I never include in the word count. It's just the actual body of it. And then remember, even though this assignment kind of spells out the different things that you're supposed to discuss in this paper, it is still a regular paper, full narrative, paragraphs, APA format, the whole shebang. Just make sure that you look both at the directions and at the rubric so you're catching all those things, and so I can give you all of your points. All right, so we're going to be talking a lot about this week about actually how do we teach nursing students to do health assessments. And I look forward to discussing those things with you. I think this will be a short YouTube video. I think that's all I've got for this week. So I hope you have a really good week, and I will get working on your papers as soon as I possibly can. And we'll hopefully have them back to you around the beginning of next week. All right. See you in the main forum.